Our moderator is Lauren Nix. Lauren joined the Global Partnership for Telehealth team in 2014 and currently serves as GPT's Director of School-Based Telehealth Programming. Lauren is a registered nurse in Georgia, graduating summa cum laude with her Bachelor of Science in Nursing from the Medical College of Georgia. After working in the hospital setting for several years, Lauren began a 14-year career as a school nurse. During this tenure, she became the first school nurse in the state of Georgia to implement a school-based telehealth program. The firsthand and practical experience gained as a school-based telehealth nurse puts her in a unique position to now assist schools across America to develop and implement successful telehealth programs. Our panelists today are Andrea Harrington and Laura Cooper. Andrea is the program coordinator for the communities and schools of Milledgeville in Baldwin County. Andrea is a graduate of Mercer University with a degree in human services and a concentration in mental health. Before attending Mercer University, Andrea served in the U.S. Army as a medical specialist and served one tour in Afghanistan. During her free time, she loves spending time with her 4 children and her husband attending baseball and softball games, and her favorite hobby is genealogy and working in her garden. Laura Cooper is a registered nurse and has been the school nurse at Needwood Middle School in Glenn County, Georgia for the past 10 years. This Jersey girl turned Georgia peach obtained her associate's degree in nursing from Bergen Community College in Paramus, New Jersey. Laura worked in a busy pediatric practice for 14 years, which has given her a perfect background for school nursing. She was also a volunteer emergency medical technician for 6 years. Laura very much enjoys working with the adolescent population and has been piloting and expanding the telehealth program for the Glenn County school system. At this time, I'll turn the presentation over to Lauren, Andrea, and Laura.
Thanks, Sherry. I would like to say hello to everyone. So glad that you all could join us today for this wonderful webinar. I'm excited about our presentation that we're going to be talking to these ladies about. But before we get started, we have just one more thing that we need to do. We're going to launch a quick poll. You should see that in just a couple of seconds come up on your screen. And if each of you as participants will please take a second to answer those questions, and we'll let you guys answer that for just a little bit. Okay, hopefully everyone has had a chance to answer those quick little questions, and we will go ahead and jump into our webinar if that's okay with everyone. So I am super thrilled to be with you guys today to talk to you about school-based telehealth amidst this pandemic that we're currently in. And I know that has been a hot topic and something that all of us have been experiencing. And so I am thrilled that I have Laura and Andy with us to share their knowledge, their expertise, their experiences. So we're going to learn a lot from their 2 very unique programs. They are totally different from one another, but I'm really hoping that we can draw from their experience through all of this and then learn for ourselves how we can better our school-based telehealth program. So thank you, ladies, for joining and being a part of this with me. So to start, I think it would be wise for us to let all the let all the attendees know a little history about your school-based telehealth programs, maybe the school systems that you work with, and just a little background information on how you got telehealth in your schools and where you are now. Laura, can we start with you?
Sure. I work at Glenn County Schools. We have a student population of about 13,000. We have 11 schools. I started telemedicine. I was told we're going to do a pilot. I was selected to do a pilot, and that was in about 2015. It was a very slow rollout of that pilot. I would say it was pretty successful. I think I did the topmost visits out of like all 120 school-based clinics the first or second year. So that was very cool and very exciting. And it was just a very slow rollout because I think that people didn't really understand what telemedicine was. And so, it's just been very slow, trickle, and gradual to growing, which I'm very excited about.
Wonderful. Thank you for that. Andy, I'm going to let you have a turn at it. Tell us a little bit about your school-based telehealth program, about your school system that you're working with. Oh, you're muted.
Course. I work for the Baldwin County School District. And so we are in a unique position here in Baldwin County. We actually have a school-based health clinic inside one of our schools, and our schools are in a centralized area. So whenever we began the process of building the clinic and getting things going, we had the intentions of busing students to the clinic if they were to, get sick at school, and that's how we would serve them during that time. However, like everything else, we run into budget issues. So we decided to go back to the drawing board and figure out a different way to, answer the call to, providing care to the students. And so we wrote a grant, and we were able to get funding to supply telehealth equipment to all the schools in the county. And so we have done that. We have 7 schools in the district. Every single school has their telehealth equipment, and including the clinic as well. So if a student presents sick at school, the school nurse can then present that student to our provider at the Be Well Clinic. So this is more of a supplemental type of telehealth program. It's not necessarily to actually access, outside healthcare services. However, we are looking forward to the future of, providing specialty care and things like that.
Yeah, fantastic. And I'm so glad to have both of you there, because there's such dynamics around school-based telehealth, school-based health in general. And there's never one correct way that fits every school district and all the needs and the community that's around. So I think it's important that people understand that all areas of it, and no matter your model, that this is a great thing to have, and that telehealth can play either the role or a role in school-based health. So very important with that. So thank you guys for sharing a little bit of history. So, you guys beginning your school-based telehealth programs probably had some grand goals in mind, and how you were going to do things and just serve the students, maybe for just acute needs, maybe you're going to do some behavioral health, maybe even some specialty consults, which a lot of our school-based telehealth programs do. But insert March 2020. And the world, as we know it, came to a screeching halt, it seems like, and things were turned upside down for everyone, but especially for the folks in our schools. And as most everyone knows, our schools were pretty much shut down, and it was supposed to be just a 2-week, and then it was extended, and we all know the rest from there. We've heard a lot of talk about how schools have been impacted and students have been impacted with their learning, the stresses that have been put on teachers and staff. But we sometimes have not heard so much about student health, other than the mental health component, obviously, of how the pandemic affected everyone. But I'd like for you guys to take just a little bit of time to tell us about how the pandemic, when it did hit in March of 2020, and then as it carried through into the next 2020-21 school year, how did the pandemic, and how has that impacted your roles and your goals for your school-based telehealth program? And Andy, we'll start with you.
Yes, ma'am. So I actually had the pleasure of writing this grant in the middle of the pandemic. So whenever we actually got our funding, that was in August of 2020. So there was quite a bit of delay just because of, the equipment shortages, because all of a sudden everybody needed laptops and everybody wanted telehealth equipment during that time. So we had a bit of a delay. And then around, I'd say December, we had all of our equipment in place. But then our second question was, okay, all of our students are being sent home immediately if they're sick, or they're not even allowed in the door. So, what can we do? So what we, came up with is that, let's look out for those students who constantly say, oh, well, my ear hurts. Oh, well, I have a headache. And let's, try to get to the bottom of those instead of really, worried about those acute medical issues at the moment. So that's how we move forward. And it was slow going, but it worked. And so our plans are to, keep moving forward. But yeah, that beginning, we were like, uh-oh, what am I doing? This is, we got all this stuff and now we can't use it.
So basically, I'm assuming that, from that time that all the students were at home virtually learning, what happened to your on-site school-based health center?
So our school-based health center had to completely shut down because there was nobody allowed in the schools because of, all the quarantining and social distancing requirements at the time. Our school shut down, so our clinic shut down. But we have came up with a contingency plan now that's in place, and if that ever happens again, that our clinic will stay open. The school board, understands the need to have that clinic open. I mean, just for COVID testing alone, is very important. So.
Yeah, you're right. And it kind of, we think we're prepared for things until something of this magnitude hits. And I think it kind of took everyone by surprise. The school districts were scrambling just for the educational purposes, trying to make sure students had technology at home and internet at home and all of that. And so I think they were so focused on the educational components, as likely they should be, that sometimes we have forgotten in the health aspects that happen at school. I feel like we're kind of pushed aside. Do you feel the same way about that, Andy?
Yes and no. I think that, we have a very supportive school board, and our superintendent, completely understands the need for healthcare in our schools, and for, making sure that every child has every access to every resource that they need. So while I wouldn't say that we're always a priority, I believe that in our situation that we are, given the attention that we need, during this time with everything else going on.
Well, that's fantastic, and I'm glad that your school system is that way. I know some schools are really on board with the health care of their students and know that successful learning can't happen without them being healthy. So kudos to your school system for doing that. Laura, so back in March 2020 and moving forward through the next school year, the past school year,
yes.
How did this pandemic affect your school-based telehealth program?
Well, just as I was gaining momentum and we were really, the board had decided to go forward more totally with the telehealth. They hired me as the telehealth nurse for Glenn County. I was supposed to go ahead and build that up through all the schools in Glenn County. The pandemic struck. So luckily, I had just started to have some children seen for behavioral health, for ADHD meds and things like that. And the practice that I was working with picked up the ball and preemptively called those parents, got them scheduled, and had them seen via their mobile devices and sent them a link. So they were able to still be served for their meds, which was super exciting and very, very helpful. The problem became, how do we have children seen still for medical visits? And that's something like Andy, I want to put in something in place where if this happens again, how will we be able to still serve them for their, medical needs, earaches, sore throats, things like that. But it really definitely, I think, brought to light for our school board the importance and, helpfulness of school-based telehealth. And so definitely their eyes are opened. Everyone's attention is now on telemedicine. So I'm very excited about that. And I think we can do a lot.
Yeah, and it's amazing that it took a pandemic for folks to realize the benefits of telehealth, because we've known it for a while. I mean, we've all been in this, and this is our world. But for the rest of the world, this was kind of a new endeavor, and it was a new thought process, and that's something we all were in a learning curve and trying to help folks, move along with the telehealth plan.
Absolutely.
So, with the students that were sick, Laura, did you guys ever come up with a plan during the time that all of your students were at home virtually learning? Mm-hmm. Did you have some sort of idea or a plan on if a situation came up with a student that really needed some services, how that might be rendered?
Yes, we did. We would, utilize, a program or software where we could send links to the parent. And so we could bridge them in with their provider, even with a school counselor or a speech pathologist, whatever service they needed. So that was very
So they could be seen from home and still link in,
yeah.
And you guys were a part of the visit.
Yes, they could, which parents were very happy to hear.
Oh yeah, yeah.
Very.
because those, the parents, a lot of the reasons why they want to use telehealth is for the convenience, and that they're at work and their students are sick and they still need to receive the health care. Andy, did you guys have any sort of way to treat students? I know everybody was home and you said your clinic was closed down. Did you utilize any telehealth during that process?
So our provider was actually working out another office that's a park. So we partner with a local provider, and they have multiple offices all over the region. And so they were able to have our provider work there, and she actually did telehealth visits the whole time. And that's also how we move forward. When we opened back up, when school started, nobody was allowed in the clinic immediately. We actually, I think, just started taking in-person patients just a few months ago. So we've been utilizing telehealth to actually keep our clinic doors open while nobody was allowed to come inside the school, because we were limiting, visitors and anybody from the outside still.
So for both of you guys, with students now transitioning back to school, have you seen some changes within school health in general because of the pandemic? And then how has that affected your telehealth programs? Andy?
I would say that I think people are more aware of their health now and the student health, and making it more of a priority than, having students come to school sick and just, allowing them to be there. I think that it's opened our eyes up to, when people are contagious, they don't need to be at school, regardless if it's COVID or strep or flu, that, we need to be more aware of these things and to, eliminate the spread of germs altogether. Now, as far as our telehealth has gone this year, it's still slow to go. We've had some transitions with, staff members and things of that nature. So we haven't really deep dived back into telehealth yet, but we are, we've got lots of plans for expansion and things that I'd like to share. But yes, we're definitely noticing that people are actually aware of a student's health more than they ever were before.
Yeah, that's right. Laura, how about you? Same question.
Oh, yes. It was a little bit slow when we first started back to school after the pandemic, because we were requiring a negative COVID test if students were ill. So that was a challenge. And I was thinking, well, how can I use the telemedicine? So I was able to connect with a provider that was willing to see the child once they got their negative swab and sign them a back to school note, because that was another thing. They needed a note from a provider saying you have a negative COVID test and now you may return to school. So that was helpful, because once the parents obtained the negative swab, they contacted me and I sent the bridge link to their mobile device at home. The provider spoke to them, make sure they were feeling better, they looked well, and had that negative COVID test forwarded on to school, and the student was able to return. So that was helpful. And then once the students came back to face and the sports all started again, then I was really able to resume my telehealth sports physicals, which is, my little secret tool for getting students enrolled in telemedicine, because we all know parents will move mountains to get their child signed up for sports. And that has always been, a good way to get my students enrolled, so that when they do have an earache or they need an asthma inhaler, hey, you already enrolled, you had your sports physical with me. So that is fantastic. I'm doing a lot more sports physicals and behavioral health. That has been huge because of all the anxiety coming out of the pandemic, some grieving for children that may have lost grandparents or parents. So more and more by the day, more students are enrolling for, ADHD medicines or to be seen for anxiety or depression.
Okay, so we're gonna fast forward and talking about all of these strategies and these things, and everybody kind of thrown to the wolves and trying to scramble to figure out what to do.
Right.
As we've moved into this school year, I at least had a hope that we were going to have some sort of normalcy, and that we were moving back to the maybe not quite pre-pandemic, but quasi pre-pandemic, and then the variants start surging, and we everybody's back. And tell me a little bit about the start of the school year thus far for both of your school systems, and what have you been noticing with the student health and those kinds of things. And also, I'd like for you to speak a little bit about some of your school policies and procedures still around students who may present with some of these symptoms. Laura, you want to go first?
Sure. Well, I tell you what, I have a lot of hope. At first, the first couple of weeks, we were still seeing a lot of very symptomatic students. Our school policy now is for the student to be sent home until they are asymptomatic for 24 hours. So then we're not requiring a negative COVID for them to return or a doctor's note. And most parents are very cooperative. They realize they need to have their child seen, or maybe they don't. And we just ask them to stay in touch with either myself, the nurse, or our attendance secretary. Have there been a few kids that came back before they should have? Probably, but we just call the parents and say they're still symptomatic. Please pick them up. So I do see some light at the end of the tunnel for us to be able to start to really engage in our telemedicine acute care appointments. So in the meantime, I'm just going to kind of keep pushing forward with the behavioral health visits, of course, my sports physicals, and increasing the awareness and of telehealth, which I think a lot of parents now, after the pandemic, a lot of the medical doctors at the hospitals have been using telemedicine. So they're becoming much more aware. And, we're just going to start thinking out of the box and trying to find other ways to use telemedicine.
So to reiterate on your current plan, if a student presents with possible COVID-like symptoms to one of your school nurses, go over that process one more time with me.
Sure. The parent is contacted. The parent is told that they are exhibiting symptoms, and I advise them to seek medical attention by a medical provider. They're told if they do get a COVID test, they are to stay out of school until they obtain the results, and they have to take a picture of the results and email them into school. And the child must be asymptomatic, off any kind of fever reducers, Tylenol, or anything like that for 24 hours before they return.
That's with a negative test, I'm assuming.
Correct.
Okay.
If they have a positive test, they stay out the 10 days.
Gotcha. Okay, Andy, thank you for clarifying that for me. And what about over in the Baldwin County schools? So tell me how the plan is right now as far as the school health and the policies and procedures that these school nurses are following.
Okay, so right now, if a student is directly exposed to COVID, they have to be out for 5 days minimum, test on the 6th day, and they can return on the 7th day. If they come to the school nurse and they're exhibiting any type of COVID symptoms, then they are put into our quarantine room. Their parents are called, and ultimately what we've been doing is making them an appointment over at the Be Well Clinic to go ahead and get that rapid test so we can get those results immediately. During the surge, we had a little bit of an issue just trying to facilitate everybody being tested because there was so many. So we were having to send them to outside clinics, or we're, telling them to even go and buy at-home tests, because for a while there it was impossible to even schedule an appointment for a test at any other providers outside of going to an ER. And that's the last place anybody needs to be right now. So that's our plan. If what I'm planning on doing moving forward, and actually was doing some paperwork yesterday, is getting that CLIA waiver so that I can purchase those rapid tests and actually have the nurses in coordination with telehealth go ahead and perform those tests in their clinic. And that way we immediately have the results. There's no waiting time. Once the parents pick them up, they can take them straight home, less exposure for other people as well. So that is our plan to move forward with that. I'm not sure how long the paperwork takes, but I'm hoping that it won't take long.
Yeah, that's a really great point. And for anybody on this webinar and looking at this, if your school-based telehealth program does not currently have a CLIA waiver in place, that might be something you want to look into, because it does allow the freedom to do, if prescribed, those rapid flus, rapid streps, urinalysis dips, as well as some of those rapid COVIDs, if your school district will accept those tests for the COVID. So it's a great thing. And then you've got the telehealth component, or in your case, Andy, like with the in-house clinic as well. If there are any negative findings, anything going on with the student, you can always follow up after the tests have been run and you're doing a telehealth consult with a full exam to be sure that those visits are handled. So I think that's a great idea. And I'm so thankful that you guys are getting that CLIA waiver. It'll take a few weeks to come through. Health paperwork trail goes with all of that. So how are you going to, is your Be Well clinic, your on-site school-based health center and their providers, will they be the ones providing those rapid tests for the schools?
No, actually, we, through our grant to provide the telehealth, it's a Reaching Rural Communities grant. So it's just about bringing, healthcare and other services to the community. So we're actually able to purchase the rapid test ourselves and have them housed at the schools. And there will be no cost to the student or their family for the test as well.
Fantastic. That's a wonderful thing to have at your fingertips. Good job on that one. So, Laura, do you guys have CLIA waiver in place at your school? And do you have any plans in the future for possibly implementing some of these rapid tests, such as COVID?
We do not currently have a CLIA waiver. I plan to obtain that. Again, it's a big school system, and I really haven't had the time because I've been running the clinic at a busy middle school while trying to build the telehealth program. So I will be soon moving full time into that position. And that is definitely something I need to obtain so that we can rule out strep throat, rule out COVID, urinalysis, so that, physicians can feel comfortable prescribing. And, you get more accurate diagnosis and, you don't have to refer the students out to an in-person facility. It's very difficult for transportation for a lot of our students is a big problem and hindrance in getting medical care. So we'll often see the same little student coming with the same complaints. And well, no, my mom didn't take me to the doctor yet, or my grandma didn't take me to the doctor yet because we don't have a car. So that's why telemedicine has been amazing for our school system. And it's going to really build up very big, I'm sure.
Yeah, and that's right. And just because there's a pandemic going on doesn't mean that those issues are suddenly gone. There is probably enhanced and a little bit more some of those barriers to healthcare. So I'm glad to hear that. Okay, so we've talked briefly about some of those acute things and if they're symptomatic for COVID. Do either of you guys have anything or any kind of policies and procedures in place for your school nurses to give them some guidance? What if it's something that acute wise that perhaps isn't COVID related, as a COVID related symptom? Do you have anything like that going on?
We don't really have any policies in place. We've left everything up to the nurse's discretion. So if they feel that, something that the student is presenting with warrants a doctor's visit, then they can go ahead and call the parent, ask them to move forward with a telehealth visit. But I would like to, in addition to the rapid test, purchase those, strep test and the flu A and B as well, so that we can rule out whatever possible, condition the student has and move forward with treating and, diagnosing them correctly.
Laura, what about you guys with any of those possible non-COVID acute symptoms, or do you have any plans for moving forward with that?
Yes. I think we're going to definitely start to use it for the more minor complaints, such as like pink eye, maybe an earache, even if we just acutely get the child out of pain, started on some antibiotics. If a practitioner wants like a COVID test done, at least let the child be seen, get them started on some medications and get that sent over to the pharmacy. So once the parent comes and picks up the child, they can swing by the pharmacy and get their medicine, take them home, let them rest. And then if the doctor says, you know what, I really would feel more comfortable if they get a COVID test as well, they can take them to the health department drive-through and get them swabbed, So I really see that we will be able to incorporate acute care telemedicine again amidst the pandemic. It's, it just has to be worked through. And when you feel comfortable with your providers that you work with, I think everybody works together as a team, and they know that the school nurses and the school personnel know the families, they know the children. You know what I mean? So it's a very perfect union.
Yeah, amen to that. And I think that's important to note that those partnerships that you have, Andy, with your providers that are there in your on-site clinics that are connecting with these school nurses, Laura, with you, connecting with your providers that them and have those relationships. Sure. Have they been supportive of you guys through all of this? Your providers, that is.
Yes, our provider at the clinic, she's, like I said, she's been doing telehealth visits during this whole pandemic. So yeah, she's definitely on board with, providing the student with whatever access to care she can. And she's been great about everything.
Good.
Yes, and my providers have been, sorry, you done, Andy? My providers are amazing. I'm running a very busy clinic, and it is like a scene out of I Love Lucy, me trying to run around and get the visit seen, and sometimes there's delays, sometimes there's little technical glitches here and there, kids knocking on my door, phone ringing, radio, going off. So they are very go with the flow. They understand the spontaneity of working with the school. So they are amazingly supportive, and I can't even thank them enough. And it's really just been amazing to see what we can accomplish. And I think the providers who do telemedicine, once they see it and what can be accomplished, they are very excited about it and willing to work with us.
Yeah, I agree with you on that. It's kind of a shift of the mind frame of what does telehealth mean? This is going to be way more difficult than a in-person visit. I don't have time for this. I need to just see them in the office. And if they, Andy, have you had experience with your providers like that? And once they experience it, it's a different mindset.
Yeah, so Kishana really didn't know, how this was going to transpire between us and the schools. But whenever we did it, a couple times, and she was like, oh, okay, this is great, because she was kind of questioning, so, how am I supposed to do an exam? And because she had never done that part of, telehealth at that point. It had all been over the phone with adults mainly. So she wasn't too sure about, how she was supposed to examine the child. So once she got started on that, and she's seen that she can not only, see what's going on, but take pictures and save them to this, the patient's file, she was like, oh, wow, this is great. So she could see progress between the, the initial visit and the follow-up visit as well.
So that brings up a good point that a lot of times, especially through the pandemic, we've seen telehealth, the word telehealth being thrown around, and it may just be a phone consult, or it may just be like we're doing, a video type call. So your programs are a little bit different from that. Can you, would one of you like to share about how that's different?
Yeah.
Go ahead, Laura.
So what is amazing, and I think a lot of the providers don't know, so there may be reluctance among providers, local providers, to become a in-network provider, is that they don't understand that we have the specialized equipment. We have the high definition otoscope and ophthalmoscope to actually examine the child's ear. The picture is amazing. It is as if they are standing right there looking in the child's ear themselves. The Bluetooth wireless stethoscope, which you connect via a program wirelessly, is like my favorite toy of all times. It's like Christmas every day for me. I love that. And the children's reactions as well, like, wait a minute, Nurse Cooper, I'm going to see the doctor. The doctor's coming to my school. I'm like, no, just come down and you'll see it. And they are just like, wow, this is so cool. And the providers also can see the child's throat, the child's eyes, ears, listen to their lungs and heart. I mean, that's like unbelievable. So, it's just having to let people have the experience of doing it. I think you can get a very effective exam. And also our input, the input from the nurses or the staff members that know these children is enormous. The connection is great.
And I will say another, beneficial factor of the telehealth is that the parents can be, involved with that visit. So, they know exactly what's going on the entire time. The doctor can, speak with them throughout the whole visit, and they can see, exactly what's wrong with their child too, because they get to see, what the doctor sees. So I think that's a great aspect, that even whenever you take your child to the doctor in person, they tell you they see an ear infection, but you don't get to see it yourself. So I think that's great. And it's a teaching tool as well.
Right. That's true.
Oh, you're on mute.
Of course I am, and I'm just talking away. So moving forward, you've touched on a few things, but I would like to hear some more strategic plans that you guys really want to see put in place or are actively working to get in place to really push and propel your school-based telehealth programs, your school-based health programs forward amidst this pandemic, post-pandemic, whatever you want to call it. What are your goals for yourselves and your programs in the future? If you can take just a couple of minutes. Andy, we'll start with you.
Okay, so to start off with, we have actually provided every school site with not only their telehealth equipment, but we've provided them an over-the-counter medication cabinet that equips them with everything, all the tools that they would have in a doctor's office. So we have ear lavages, we have all wound flushing kits, we have, top of the line, everything ready for them to use, so that they don't feel like they're ill-equipped. Like, well, the doctor says to do this, but I don't have it in my office. So they have it. Secondly, we've moved forward with providing mental health care visits as well. We have a full-time staff member at our clinic now that is a behavioral provider. So she is able to diagnose and treat with medication any type of behavioral issue that the student may present with as well. We've actually purchased additional equipment so that session can be done privately. And one of our assistants, which I failed to mention, we've hired 2 medical assistants that actually rotate to support our school nurses. And the plan is to actually have a permanent assistant at each school moving forward. But yeah, we've got the mental health care aspect, we've got the medications that they need, and also we've had some presentations. We haven't narrowed it down to a single provider yet, but we do plan on providing this specialty care equipment at our actual Be Well Clinic site, so that the provider can present the patient to a specialty doctor, say like for asthma or diabetes and things of that nature. Because we are so rural, the patient would have to travel usually at least an hour or more, not to mention missing school, to have that session. So we're hoping that we can meet all needs of the child's healthcare, not just those acute visits.
Oh, that's a fantastic plan. And the support that your organization is providing to the school health team, the school nurses that are there, I'm just so excited to see the future of your program. I think it's going to be great. And I kudos to you for heading all of this up and having these wonderful ideas and pushing it forward. Okay, Laura, for the future, what's going on?
We're going to be hitting it out of the ballpark. We are already increasing our behavioral health appointments. I will be going to the principal meetings and speaking to all of our principals about telehealth. I'm going to do demos. I'm going to show them. I'm going to do a mock session with them so they can actually see it live and get as excited as I am about it. Definitely sports physicals. Boy, that gets their ears. I'll tell you that. I've had sports physicals done where the bus is pulling out for the team, and they're like running after the bus. So, and just getting our CLIA waiver, increasing our parents' knowledge about it, just working with our school system to kind of put out some more social media things about it and increase the knowledge. Everyone's very excited about it. I think they're starting to realize what it is, what it does, and how we can really start to treat the whole child, even, at school, and really, really, really be able to take care of the needs that we so desperately want and hope to be able to address for our kids. So I'm really excited about it.
Very, very good. Thank you for that. And you have always been a leader, I have to just say, on the mental health realm too, with behavioral health services and mental health things. Do you have plans to continue and forward that on as well, I'm assuming?
Oh, absolutely. Absolutely. I have calls coming in probably as we speak from different schools out of the 11 schools. So I'm going to be very busy with that.
We need to get you some help over there too, Laura.
Right.
Okay. Well, you guys are doing an amazing job. And I think you're role models for other school systems and other school health teams that are across this nation on how we can all pull together and as a community, as a school system, as the providers, and everybody work together to provide these great services for students. We do have quite a few questions.
Yeah.
If it's okay with you guys, I will go ahead and read those off. So the first question is, what platform was being used for the delivery of telemedicine?
Who do you want to answer? You want me to answer?
It was asked, and so yes, you can ask.
Okay. There are several platforms. Different providers use different platforms. So there are many options out there. There's Pathways, there's Doxy. There are several. The hospital systems have their own that they use. Private providers may have different platforms that they use. So there are many to choose from.
Very good. Okay, next question. Is Wi-Fi connectivity an issue when you are connecting to the outside provider? Andy, have you guys seen any connectivity issues in the schools?
No, ma'am. However, at the beginning, we did have a firewall issue. However, I just let the IT people know that, hey, this is, preventing us, because we could log on, but for some reason, the firewall wasn't letting us have the camera interaction. So they came over, they typed in a few things, boom, we were fine. But as far as the connectivity, no, there's no Wi-Fi issues. None of our equipment is hardwired in so that it's mobile and it can move with a nurse if need be.
Okay, great. Next question. When providing telehealth, school-based health services, how long does the encounter usually take, and who are the stakeholders in the workflow? So this may be a little bit different for each school system, but Laura, we'll let you answer that one first.
Sure. The encounter usually only takes a few minutes. Like for a sports physical, I set them all up. I send the forms in to the doctor. We have an appointment time. I pull the child down about 5 minutes ahead. And as long as we don't have to wait for the provider, it only takes a few minutes. Same thing for an acute care visit. Barring any wait for the doctor, I'm usually working with sometimes urgent care doctors, sometimes regular primary doctors. So, and every now and then you have a wait time for a provider if they're busy, just like you do if you go to an in-person visit. But generally speaking, it's maybe no more than 5 or 10 minutes.
Andy, is it the same in your school system, the wait times, and how long does the normal encounter usually take?
Usually if we can call over to the clinic, we'll be told that, to wait about 10-15 minutes because she'll do those in between patients being there in person or what's already scheduled. And so that gives the nurse time to go ahead and do that intake form and go ahead and check the vitals and everything else of the student. And then the typical interaction takes about 10-15 minutes as well.
Right.
Okay, the second part of that question, I do want to bring this part out. Who all is involved in the workflow process of getting the appointment done and completed? Andy, on your end.
On our end, unless they're having a hard time, reaching the clinic for whatever reason, like their, phones are just, all ringing off the hook, like during that COVID surge, the nurse calls directly over to the clinic and they just speak with the clinic and they get their appointment time set up.
So for me, it's a little different because I've been the only one doing it in our school system. And I've also been running my clinic. I mean, I've been doing everything myself and it has been quite difficult, and hence the I Love Lucy episode. But moving forward, I will be doing telemedicine and floating around to the different schools. So I'll be able to manage that appointment making and scheduling and hosting the session so that the school nurses will not have to try to juggle that amidst everything else they have to do.
Okay, great. Great.
Yeah.
So both of you guys have plans in place for really helping pull some of that load off of the school nurses. Sounds like it's a good idea. Okay, next question. Are the providers that your kids are seeing strictly MDs, or do you also use mid-level such as an MP?
Yes, we have actually a nurse practitioner that works out of our Be Well clinic. The MD that she's operating under is, like I said, part of that healthcare network. So yes, we use strictly PAs. Even our mental health provider is a PA as well.
Okay. All right, you too?
Yes, pretty much everybody, MDs, PAs, clinical social workers.
Okay, so the next question kind of tacks on to that. They're asking what the reimbursement models are for the MAs and physicians, et cetera. So we would have to, that I'd like to mention is state specific. So you're going to, depend on what your state is, you're going to do that. But do you guys care to share about some of the reimbursement stuff that happens with your schools?
Okay, so whenever our parents fill out the consent form, we go ahead and provide that to the clinic. And so they're like typically a lot of our students, just because of the area we live in, unfortunately, a lot of it's low income. So the students are on Medicaid often. So they go ahead and certify them in their system. So that's strictly billed to Medicaid. Now, on the side of the nurses, if the nurses are presenting, then we are allowed to bill Medicaid for that presentation cost. And that's usually ranges from, I believe, like $20 to $35, depending on which Medicaid plan the student is under. And so that is done separately on our end, but there is no upfront cost or anything like that for the families at all.
Laura, do you have anything to add to that, or?
Right. No, we haven't started billing yet for telemedicine, just the provider's bill to the child's insurance, and it's usually like Andy's school system, Medicaid, Amerigroup, WellCare, CareSource, the state-based programs. So, but never, they don't have to pay anything out of pocket for their visits, except for the sports physicals. Sometimes they have to pay $35.
Okay, great. Mm-hmm. Okay, next question. What type of provider do you have for your behavioral health appointments? For example, is it a licensed mental health counselor, an ABA therapist, such as that? Andy, so who do you guys have in your clinics?
Ours is a nurse, a PA, that she is strictly trained in just mental health care, behavioral health. She doesn't really provide any counseling. We have looked into reaching out and getting some MOUs with actual counselors and other types of therapists, but at the moment we just have that nurse practitioner.
Okay, Laura, for your kiddos that are connecting in for mental and behavioral health on your school end, what types of therapists and providers are you connecting with?
They generally see either child psychiatrists or nurse practitioners that are certified in behavioral medicine. At this time, we are now on board with some local counseling agencies, and we'll be starting to build that up as well.
Okay, good. Mm-hmm. Okay, next question. Are you conducting any behavioral health visits after school at home?
Okay.
We have presented that as an option. We just got her schedule built up. So initially she does want to see all of her patients in person to go ahead and build that relationship and things like that. But then moving forward, we will be allowing them to do the mental health visits at home. And also another topic that I didn't discuss is that we are looking at providing telehealth equipment at like our community centers, so that if they need to utilize it, if they don't have access to the internet at home or a computer, that they would be able to do that there as well.
That's a good idea. Yeah, we generally have our first appointments. The parent definitely has to be there in person with the child. And then from there, for the follow-up visits, we just send the parents a link to their mobile device or PC so they can join the session. I tell people it's kind of like a 3-way FaceTime call. And so that's very convenient. And parents do not have to have the appointment during school time. It's up to them. Once we connect them with that service and that provider, if they can get an appointment for 4:30 when their child gets off the bus, then they're welcome to do that.
Great. Okay, and one last question, it looks like. At what point is parental consent obtained? Prior to the encounter? Question mark? Laura?
Yes, usually it is. Yes, we have new patient forms that get filled out, just kind of like when you go to the doctor, you fill out an enrollment for new patient. It's your demographics, your health history, your allergies, your insurance information, and that gets sent by the nurse to the doctor or provider ahead of time. So that has all the consents signed on it. Now, during COVID, of course, that was waived for a little bit where you didn't have to have it in writing prior to the session. So, but generally, it is definitely obtained prior to the appointment.
Andy?
And we do the same. We've actually sent out, forms for everybody in the school to sign that consent form digitally. And so we have a database of those that we share with the school nurses. But however, we still, before the visit, they're calling the parents and getting that verbal authorization too. We don't move forward without that.
Right.
Okay, I don't see any other questions, but I'm sure folks are probably have a few more. I would just thank you, both of you guys, so much. Again, you're just steamrolling straight ahead. I am proud that to know both of you and to
Thank you.
know that GPT can support you guys in this endeavor. And I hope you continue with your telehealth programs strong and just be shining lights for everybody else and how they can handle school-based telehealth amidst a pandemic. Thank you, ladies.
Thank you.
Sherry, I'll turn it over to you.
Thank you, Lauren. Andrea, Laura, Lauren, thank you all so much for your time today. I think the information you presented has been very timely, and I'm sure everyone out in our audience certainly appreciated that information. For those who are watching right now, this session was recorded and will be out on the gpth.org website in just a few days. So if you need to go back and maybe re-listen and catch something maybe you missed, or if you want to share this presentation with any of your colleagues, please feel free to go to gpth.org and do that. I want to invite you all back here next month on October the 28th, 2015, at 12:15, not 2015, at 12:15, we will do another presentation. You can register for that presentation also on the Global Partnership for Telehealth webpage at gpth.org. When you end the call this afternoon, you will have a survey that pops up on your screen. For those of you who are wanting CEUs, it is required that you fill out that survey. And for those of you who are just listening in today and maybe not in need of CEUs, we still ask that you fill out that survey. We want to know what you want to hear about in our webinars. We really try to make our webinars relevant to what you're asking for and interesting to you. So please feel free to do that. Any information you provide is greatly appreciated. And with that, I want to thank our panel and our moderator once again. Thank you all for your time today, and we'll see you back here next month. Thank you.